Headaches. Okay. I know that wasn't, I wish I could do, a lot of people with Bell's palsy, they don't want to show their before. They're okay showing their after, giving me a testimonial, but before they're kind of, it's an aesthetic thing. But hopefully that was beneficial for y'all to see that. Okay, headaches. Let's move on to headaches. So migraine headaches, chronic daily headaches, medication overuse headache. I know y'all treat headaches, so I'm not going to go too much into it. It's something y'all already do. Many of y'all probably are experts at it, so we won't do too much about that. Again, this is just another reminder, when you're thinking about what decisions to make, how to make a decision, will it help your patients achieve their goals? Will it change your treatment? Will it provide clarity for your patient? So migraine headaches, defined as severe throbbing headache or pulsing sensation, usually on one side of the head. It's often accompanied by nausea, vomiting, and extreme sensitivity to light and sounds. Migraine attacks can last for hours to days, and the pain can be so severe that it interferes with your daily activities, okay? From Mayo Clinic, from Google. The typical causes of migraines that I've treated. So I mentioned on Wednesday, the number one cause is, I don't know why this keeps on going to red. Okay, cervicogenic, so neck. Neck is the number one cause for migraines. So when in doubt, treat the neck. If you have someone who has a headache or migraine, when in doubt, always treat the neck. Okay, menstrual. Okay, very good at that. So I'll have a case study of someone who had menstrual migraines where I use just herbs, no acupuncture. So migraines, I have been able to eliminate just with herbs, just with acupuncture and just with herbs. I usually like to combine the two, okay? Toxins, medications, drugs. This one sometimes is not always easy to eliminate 100%. I actually had a patient who had chest pain, and she didn't have a heart attack. All her cardiovascular tests were normal, but she still just had chest pain. And so they gave her a medication. This is funny. It's not funny, but they gave her a medication to stop the chest pain, and it does stop the chest pain. Okay, but the side effect was it gave her a migraine. Okay, so now she didn't have chest pain. Now she has migraines. So it's like, which one does she do? She can function and do her job a little with chest pain, but it makes her anxious because she thinks she's having a heart attack, and then so she thinks she's going to die. But then if she takes the medication, she gets a migraine, and the migraine, she can't do her job. So she came to me to help her with the migraine. So I was able to reduce at least 50% of the migraine. So the migraines would only last for about, not only, but it would last for about 8 hours, and then the medication would wear off, and then she would no longer have a migraine. Okay. So I helped her reduce that intensity by 50%, but the side effect of that medication was way too strong. I could not eliminate it 100%. Okay. And I did not want to, I did acupuncture on her only. I did not want to do herbs because chest pain, I don't want to mess with that. Okay. Food sensitivities. Some people who have high gluten sensitivity can get migraines. That's actually a simple fix. It's not really a fix. It's a solution. They can stop eating, gluten, but they still will have gluten sensitivity, food allergies. Okay, so it's not really a fix. Weather changes, barometric like allergies. Okay, those are those you can eliminate 100%. Blood pressure. Okay, if the migraine is due to the headache or migraine is due to the blood pressure, elevated blood pressure, and not from the side effect of a blood pressure medication. So side effects of medications are hard to counter. Medications are powerful. It's very hard to counter that. And so, but if you have blood hypertension and it's causing a migraine, then that is fixable. Okay. Initial exam, it's the same thing, so I'm not going to go through that. Initial exam, diagnostics is also the same thing. Functional ortho, you can do some ortho exams, blood labs, cervical imaging, thermography. So range of motion testing, just have them move their neck left and right. You can do compression tests. So the compression test is basically I push down on their head and I'm just trying to rule out the cervicogenic cause. So if it's the migraine is caused by their neck, okay? So I push down someone like this, you push down someone, they're not supposed to feel anything. Okay. So if they feel more pain when you push down, then there's structural damage in their spine and it's pushing on the nerve. And then you turn their neck to the left a little and push down again. Okay. And then you turn to the right and then you push down again and see if any of those causes the migraines or the headaches to get worse. If it does, then it's definitely come from the neck. Okay. If you don't feel comfortable doing the compression test, do not do it. That's why I said, when in doubt, treat the neck. Okay. This is how I do it. This is how I teach my associates. They don't know how to do these stuff, this compression and stuff, but they still can get great results because they just treat the neck. Okay. So prognosis, severe structural damage. Again, we can't eliminate the headaches 100%. The goal is 50%. Okay. Medication induced, like I said, it's hard to overpower the side effects. So if we can get 50%, then it's great. It's good enough. And so again, it's not even really about the 50%. So like the patient that I was telling you about, her goal was to be able to get back to work. Because of her chest pain, she had to take off of work for over a month. Okay. And so, and she was the primary breadwinner for her family. So 1 month of no income, it wasn't cut, was her life effect. She couldn't have that. So what I did, even though I only reduced her migraines, and I also helped her for chest pain too. Her chest pain, I reduced about 80%, but she would still have it. It would still make her anxious, like she's having a heart attack. And so even though I didn't 100% eliminate her pains, her chest pain or her migraines, what I did do was what she wanted. And this is why it's a success, because I achieved what the patient wanted, not what I wanted. I want to eliminate 100%, but that's not my goal. My goal is to get the patient what they want. So what did the patient want? She wanted to be able to get back to work so that she can start producing for her family. And so she is back to working around 30 hours per week now. Okay. So she was super happy. Other causes of headaches, it's possible elimination 100%. Okay. Treatment protocol. Okay. I'm going to go through this. So I'm not going to answer your questions now. Okay. So I'm going to go over all of this, your questions later, afterwards. Hopefully I can get, if I don't answer your question, just email me. Okay. And I will give you the email afterwards. So email me and then I will answer your question. Okay. Because I do, my promise is to answer, and I said in the beginning, I will answer all your questions. So migraine headaches are constant. If they're constant, the rate of response treatments is 3 treatments in 7 days. In 3 treatments, you want to see a reduction in their migraines. No, you're not going to eliminate the migraine, but you want to see a reduction. Okay, reduction here. And then afterwards, you can go 2 to 3 times per week for 4 weeks. And after a month, at least 50% improvement. Okay. Migraine headaches that are infrequent. Let's say they only get once a week or once a month. And what do? Well, you do 6 treatments within 14 days. Okay. Or you try to plan out when they're going to get their next migraine. Okay. Usually that's hormonal. And that's the case study that I have. Hormonal case study. Okay. The results expected is the same. Monthly treatments is twice a week for 4 weeks. And after 1 month, at least 50% improvement. Are y'all seeing a pattern? My treatment plans are almost the same for everybody, right? They're almost the same. My treatment, the way I do acupuncture is pretty much the same for everybody. The way I come up with the diagnosis is pretty much the same for everybody. And therefore my treatment plan is pretty much the same for everybody, right? Remember what I said in the morning? One system. Wouldn't it be great just have one system to treat everything. That's what I do in my clinic, right? And I have a whole hallway of testimonials to show that it works. So some people are afraid, like, oh, if I only use one system, am I going to be able to get great results for every type of disorder? Well, my clinic shows that it can. So the acupuncture, it's the same thing, okay? If you got a migraine headache, I already talked about the vertex headache, the occiput headache, okay? I already showed you the imaging. I think most everybody got it. Technique, you put 5 needles in and you ask what % of the headache is gone, okay? I instantly ask, I'll put 5 needles and then I'll ask, okay, what % of your headache is gone? So, because I expect instant result, instant relief. Herbal treatment, again, no magical herbs. You identify the organ dysfunction. Single herbs you can use, but they all work, okay? Dietary modifications, same thing. Supplements, there's one thing that's different here, but one thing is, again, remember the calcium, magnesium? So migraines, pain. When you have pain, the nerve is overactive. So you can calm the nerves. Migraines, someone was asking about anxiety. You can calm anxiety by giving them calcium, magnesium. Okay, just a standard dose. Start with that and then work your way up. Yes, you got to be careful with both of these. Calcium, too much calcium cause kidney stones, right? If they have a kidney problem, too much magnesium. Well, who knows what happens if you get too much magnesium? Anybody know? They'll be spending a lot of exactly. They'll be spending a lot of time in their bathroom. Okay. But maybe they need it, right? Isn't there, what's that strategy? If you have excess at the top, you purge it from the bottom, right? So it's like, if you got all this pain and headaches, migraines, then you unplug it from the bottom, okay, and it drains it. All right, fish oil, okay, and this is something different. Okay, so I'll go over it. So I use glandulars, okay. I use glandulars. So glandulars are basically, so remember Chinese medicine, if you have a problem with an organ, you go eat the organ of an animal, right? So if your liver is dysfunctioning, then you go eat liver of an animal, right? It has all the nutrition you need to get your liver to function better. So not everybody likes to eat liver, and not everybody likes to eat spleen. Not everybody likes to eat adrenal glands, right? So that comes in a capsule, and sometimes I will use that, okay? And so the company I use is Professional Formulas. They only use glandulars from New Zealand or Australian cows, okay? Professional Formulas. So Australian and New Zealand are the best cows. They are grass, grass fed. They're free range and no, hormones and so forth. Okay. Other modalities, gua sha and rapid release therapy. So we do it on their shoulder. A lot of times, if you relax the shoulder, you'll relax the impingement on the neck, which will stop the migraine headache. All right. So this is a case study this is a case study of 40-year-old female complains of menstrual migraines. Okay. So she only gets migraines right here on cycle day 1 and cycle day 2. And every other day, she doesn't have any symptoms, no migraines. It's debilitating until migraine goes away, like she has to go home from work. Last menstrual period was 12/31/19. Her cycle is also erratic. It goes through 24 to 28 days. Okay. Her diagnosis, based on my functional pulse diagnosis, was lung damp, middle jaw damp, bladder qi stagnation, and kidney qi stagnation. Okay. So my treatment plan for her was 1 pulse reevaluation per week for 4 weeks and herbs daily. As I noted, I only use herbs to treat her. Okay. So here's my progression. I figured y'all might want to, this might be interesting to y'all. So progression from when, you know, I'm not going to list all the week's herbs I gave her because I would have like I have in this, for this weekend's presentation, I have 167 slides. If I put all of the herbs that I put in there, we would probably have 1,000 slides. Okay. So in month 1, week of January, okay, here's the diagnosis: lung damp, middle jaw damp, bladder qi stagnation, kidney qi stagnation. So I used 芍药甘草汤 20 grams. Okay. So qi stagnation basically means when I feel in the pulse in qi stagnation, it's like constricted. The blood vessels are constricted. They're tight. Okay. They're tight. So I want to put something to relax them, to open them up. Okay. So sweet herbs like 芍药甘草汤, sweet herbs relax the pulse, right? So it can relax the bladder qi stagnation and the kidney qi stagnation. 川芎茶调散. So lung damp, okay. Also, there's 2 things. Lung damp also refers to the lung, upper respiratory is upper jaw. So I want to open up the blood vessels into her head, right? But also bladder qi stagnation, the right shi pulse is a bladder pulse, right? If you go further down, that reflects the neck. So if there's bladder qi stagnation right here, there's neck constriction. So I'm going to use 芍药甘草汤 to relax it. I'm also going to use 川芎茶调散 to open up the constriction. Okay. 柴胡清肝汤. Okay. This I use for middle jaw damp. It will raise that dampness. Okay. So I can move, besides moving blood to the area to raise the pulse, you can move qi there to move the blood. Right? So 柴胡清肝汤 can decrease the dampness and also has some qi moving herbs, so it can lift the pulse in the middle jaw damp. Okay. So the next week, you can see a week later, then I felt the lung and heart still damp, middle jaw still damp. Now the bladder qi stagnation turned into heat, and the kidney had insufficiency heat too also, right? So I didn't change too much of the pulse, of the herbs. I still trying to see if I can relax it, okay? But what I wanted to focus on more was you see I changed the dosage of 柴胡清肝汤. I wanted to see, maybe I need to increase it to move this pulse up. Okay, so again, remember she only has migraines during the headaches. Migraines during her period. So I don't know if it's working for her migraines yet. I'm just basing it solely on the pulse. Okay. Okay. Let's see. Come on. Stop. Cancel. Okay. There you go. Hey. Wait. Stop. Okay, there you go. Oh, shoot. Okay. Okay, so next. This is not month 1. This should be month 2. Oh, it's still month 1. Sorry, still month 1. So 7, this is January 20th. This is January 28th, so another week gone by. So she had her period on January the 24th. It was a 25-day cycle day, okay? And she had a migraine the 2nd day. So she didn't have a migraine on cycle day 1. She had a migraine on cycle day 2. So that was actually some success, okay? So when I felt her pulse then, she had lung phlegm, heart phlegm, spleen damp, liver damp cold, and bladder stasis. So with this bladder stasis, that means in the neck. There's stasis in the neck. So I use 羌活胜氏汤 30 grams to address this, okay, to decrease the inflammation in the neck. liver damp, cold, and the middle jaw is still damp. So I'm still keeping it here. But now she had some allergies also. So she wanted me to address that. So I added Zhang'erzisan into it also. Okay. And then so I did this for a couple weeks. And then the week of 2/13, she came back and there was still lung and heart phlegm in there. The spleen and liver damp were still damp. And bladder and kidney stasis with deficiency. Okay. So now the bladder stasis is becoming deficient now. All right. I still kept the Chai Hu Qinggan Tang. I think the reason why I kept it, I don't have the drawings with me, is because it was improving. Okay. It was improving. The diet, yes, diet does help. Her diet is already good. That's why I didn't address the diet. Her diet, she's eating great. But that's why she couldn't understand. She's eating great, she's exercising, but yet she's still getting these migraines. Okay. And so for the lung phlegm and the allergies, I still kept Chuanxiong Ca Tiao San. And kidney stasis, okay, the kidney stasis, this is adrenal. So for stasis, I use Shaofu Zhu Yu Tang to get rid of the adrenal, to help the adrenal part, to remove blood stasis from the adrenal. Okay. So the next menstrual period that she had in 2/20, she had no migraines. Okay. I know it's kind of a little confusing with without seeing my pulse, because I didn't, I didn't really schedule that much time to talk about pulse, because the reason I did the last webinar, not everybody liked learning in my pulse. They just wanted to know the points and formulas that I used. And so that's why the last formula at the last webinar that I did, I went in detail on my pulse. But that's why this time I didn't. And actually, I'm finding out that actually this webinar that I'm doing this weekend could actually go into like 2 or 3 other webinars, because I know I'm skipping through this pretty fast. But it is what it is. So since 2/20, she has had probably just one. We are in, what are we in? July. I'm still treating her on maintenance, but she's coming in for other problems now. She had about a shingles. She had a bout of constipation. She wanted to help me. She wanted me to help her with. And so since then, she's only had about 1 or 2 migraines. Pretty much the last 2 months, she has not had a migraine, menstrual migraine since. Okay. So I just wanted to share this case. It was only herbs. Okay. They're done. Okay. So hopefully that was helpful. Was that helpful or was that kind of pointless? Let me know.